My name is Dr. Frank Jones and I'm president of the Atlanta Medical Association. I want to invite you to come and view our next episode of Ask a Black Doctor. This episode is extremely important because we're going to be focusing on our senior population. We know that they have been hit extremely hard by this COVID-19 disease, and we wanted to go directly to our seniors and ask them what are some of the questions that they have about COVID. And so we did just that. We asked some of our friends, some of our family members, some people that live in assisted living facilities, nursing homes. What are your questions? And then we went out and got 3 experts who take care of elderly patients to answer their questions directly about COVID. So please watch this episode, share it with your friends, share it with your family, share it with your colleagues. Ask a Black Doctor, focusing on elderly patients and COVID-19. Thank you.
Good afternoon. I'm Dr. Monica Parker, Director of the Minority Engagement Corps for the Goizueta Alzheimer's Disease Research Center. In my past life and currently now, I am a family physician, geriatric primary care provider at Emory University.
My name is Dr. Antonio Graham. I'm a geriatrician here at the Atlanta VA. I'm also an assistant professor of medicine and geriatrics at the Emory University School of Medicine.
Hello, I'm Dr. David Blake. I'm a family medicine physician practicing here at Family First Healthcare in Lithia Springs, Georgia.
I'm a 20-year kidney patient survivor, and daily we struggle with just daily living with the immune system. And I'm just concerned about what should my extra precautions with this COVID-19 that I should be aware of. I should be cautious.
The gentleman asked, because I have chronic kidney disease and chronic kidney failure, what kinds of things should I be concerned about with COVID-19? Well, first of all, as somebody who has chronic kidney failure, you're in the category of what we call a vulnerable adult or vulnerable individual. So who's a vulnerable adult? A vulnerable adult is anybody who's over the age of 65, anybody who's immunocompromised, i.e. somebody who is taking medications to suppress their immune system, like people with rheumatoid arthritis, people who are kidney transplants, people who probably have chronic obstructive pulmonary disease or lung disease. Anybody whose immune system is already impaired. Why is this a problem for you? Because you are more likely to develop the infection, but more importantly, you're more likely to become maliciously ill because of this infection. So what can you do to protect yourself? Well, the first thing is, unless you have to go outside, is you stay home. If you do go outside, you wear your mask. I think I have a mask around here, but wear your mask, put your gloves on if you're going to be handling things, maintain the 6-foot social distance that the CDC has recommended that everybody follow. Those people who are particularly vulnerable don't need to go to the grocery store. Send somebody else. Order in. You don't need to sit out front with your friends. You don't need to go to bridge club. You don't need to do anything that's going to bring you closer to somebody who is likely to have this infection.
I know that it's been said that immediately when you go out and come back in and wash your hands, to sterilize them with soap and water and all. But is it important that we wear gloves or not wear gloves? There's been some said that they contact more germs than they prevent. So should we wear gloves or not wear gloves?
The gentleman asked, should I wear gloves with this COVID-19? Are they helpful or are they not helpful? Well, if you are coming in contact with bodily fluids, you should wear gloves. And as soon as you take those gloves off, you should wash your hands for 20 seconds with soap and water. In the event that you can't get to soap and water, you should use hand sanitizer with at least 60% alcohol content. Gloves can be worn, but you have to keep your hands safe from infection. That's why you wear the gloves. If you take the gloves off, you still have to wash your hands and throw the gloves away.
How many people can come to my house if I have the space available 6 feet apart?
I've been asked how many people can come to my house for whatever. The CDC guidelines state that if you can't maintain a distance of 6 feet distancing, that maybe you shouldn't have that particular gathering. Now, if you're all within the same family and you live together, you need to practice social distancing, but bringing people into your house, it limits. If you can't make 6 feet of distance between all the people you're inviting to your house, think about doing that event outdoors, where you can more likely accommodate a 6-foot social distance. But if you can't accommodate a 6-foot social distance inside your house, you don't need to plan that kind of gathering. I'm going to refer everybody again to the CDC website, www.cdc.gov, and their special guidelines for having social events in your home and how many people you can have. Again, if you can maintain a 6-foot distance, likely you can have those people there. But if you can't, you shouldn't.
Question was presented as to how many people can gather in a home if you have the appropriate space. Keep in mind that we want a social distance at least 6 feet apart, so that way you have to think about the dimensions of the home and or the area that you're going to occupy. Say, for example, if there's a 10-foot area, then that's 2 people to be 6 feet apart. Then there's also limitations as to how many people can gather, and it was 10 people. It has recently been raised to 25 people. So depending upon the size of your home, how many people are going to be in the area. So if you're having a party, some people are outside at some point in time, others are inside, then you could probably expand up to the 25 people, just not all in one room at the same time. So if you have a nice 3,000 square foot home and you have outside nice driveway setting, you can have 10 to 25 people to enjoy your family time and family friends with.
The cost of the mask, will Medicare cover?
We're now having to wear personal protective equipment, PPE. Does my insurance pay for that PPE? Does Medicare pay for that PPE? Well, this is one of those things where we have to take our own responsibility. Insurance is likely not to pay for your masks, your gloves, or any other kind of protective equipment if you are not a healthcare provider.
My name is Martina James Bryant, and I am a curious senior citizen. I have questions regarding to language used regarding COVID-19. In my reading and watching television news, I often hear the terms coronavirus and COVID-19. My question is, are the two terms used synonymously?
Coronavirus, COVID-19, is there a difference between those two different things? Yes and no. Coronavirus is a class of viruses. The common cold is a coronavirus. But the coronavirus that we're experiencing right now, COVID-19, that's its name, is more deadly than the coronavirus that causes a common cold. And because of the pandemic, we're saying coronavirus, and we're using it to mean COVID-19. So when you hear these things in the news, when they say coronavirus, think COVID-19. That's what they're referring to.
I'm Robert Caldwell, and I have a question concerning COVID-19. COVID-19 suggests that there are other viruses in that family of viruses. If so, how many of those viruses are detrimental or deadly to humans? Secondarily, can this COVID virus be transmitted in any other form other than airborne or from physical touchings of surfaces?
So there are multiple coronaviruses. This particular strand, which we call the SARS-CoV-19 2 strand, is the one though that we now seems to be resistance for and really have no treatment for. So there are other coronaviruses that are very common in children that don't cause this type of deadly disease. The other thing is that kind of the same universal precautions for all viruses is transmitted by respiratory droplets. So, good hand washing, making sure that you touch any surface that you either use a sanitizer or actually washing your hands is important to stop the spread of the virus. But of the coronaviruses, this is the one that is the most deadly.
My name is Clarence Forth, and there seems to be an epidemic going around, at least in the African American community, called the coronavirus. And I'm wondering, what effect does it have on African American, especially the older generation, the ones that's over 60 years old?
So coronavirus is affecting the African American community in a disproportionate way, mostly because a lot of African Americans have all of the comorbidities, i.e. diabetes, hypertension, and autoimmune diseases that makes us more prone to having more severe viral symptoms. So as a result, it's being expressed worse in our community, not only just in older adults, even though most older adults tend to have some of those comorbidities, but also in younger populations, because a lot of African American younger people also have these conditions.
We are Colonel Retired Walter and Joyce Watson. Our question is,
if you have had COVID, are you immune or can you be reinfected?
So COVID as we know it, kind of again, this is evolving data, but as we know, and people are infected, there is an immune response that is mounted. We believe that everybody makes some level of antibodies, but it's variable depending on your immune system. So we can't necessarily say that you have full immunity because we're not sure, but you should have some protection if you were to get exposed again, is kind of the thought as of right now.
My name is Jean Caldwell. I am 76 years old. My question is, what are the symptoms of the coronavirus?
So the symptoms for coronavirus can vary, but there are kind of three really common symptoms. So about 80% or so people have fever, about another 60% will have a cough. Shortness of breath is a third symptom. Loss of taste or smell is a symptom. There's even some pink eye kind of being associated with people who have COVID, but the big three are cough, shortness of breath, and fever. Also nausea and vomiting and diarrhea can also be a symptom.
My name is James Drayton, and I'd like to know when I could go to Waffle House and enjoy a real sit-down meal.
An older adult who would like to go out to a restaurant such as Waffle House and have a sit-down meal, if this older adult has multiple medical conditions, I would actually warn against it, even with wearing a mask and social distancing in a restaurant, because there still is some chance of transmission. And so if you're already somewhat frail, it's probably best to stay out of the restaurants for now.
When can you get out and about again and enjoy a meal? That was the question that was asked. That's going to be a unique decision made by the person. We want to socially distance. You want to wear your mask. You want to find a facility that is open for in-house dining, and then make sure that their servers and patrons are all wearing masks and are socially distanced. So if you want to get out and enjoy a meal, you pick your favorite place. You make sure that they are indeed seating inside, or if they have outdoor seating, that's even better for you. Wear your mask and make sure that they're socially distancing between the patrons in the establishment, and enjoy your meal.
Hello, my name is Yvonne Fort, and I have a question that I need some support answers to. And the thing is that I'm concerned, is there any type of agency that can offer emotional support to families wherein there's an older population there, the grandparents or whatever, and some family members have the coronavirus? If there are any agencies or anything that can give these families support during the time of the situations?
So support during the coronavirus, especially for older adults, as you know, we would like for people to stay social distance. So if possible, using technology such as FaceTime or other video chats are one way that you can still keep in contact with loved ones. The other thing is if severe mental illness occurs, or depression, anxiety, a lot of therapists and psychologists are doing telephone and video visits as a way to support families during this time.
When the vaccine becomes available, because of our age, should we take it?
Question was posed as to whether or not you should receive the vaccine when it becomes available based upon a person's age, particularly our seniors. Well, once the vaccine gets created, you definitely want to pay attention to the recommendations that come from the CDC. Typically, vaccines have an age range on them as to who should receive them, from the very young to the extremes of age. So if the age range that's put out there, that after 2 years old to 90, then that would be fine. So that answer is going to have to really come once the vaccine gets put out. But I do recommend that once a vaccine is available, you find this information out to make sure that you are in the age range and receive the vaccine to further protect yourself from catching this disease.
My question is, why are African Americans more susceptible to the coronavirus?
My question is, why is it that it's predicted that the virus will return back in late August or September?
The question came up as to why African Americans are more susceptible to coronavirus. There are many ways to approach this, because one thing that we all have found out, it deals with numbers of people in close gatherings. African Americans typically might have more people living in a home, and so it's very difficult to distance yourself from your family or loved ones. Multi-generational homes, you'll have grandparents, the parents, and then children, sometimes even great-grandchildren living in a home together. So the more people, that will increase the susceptibility. Next is also the issue of getting to appropriate health care. Many African Americans do not have health care coverage and or do not go to see their physicians on a regular basis or as soon as they might feel symptoms. So once the symptoms are felt and you don't get care and treatment, it then will get worse. So if you start to feel feverish, if you have a cough, you notice anything different about how you typically feel, go ahead and contact your physician and get seen to decrease your susceptibility to this virus. It has been asked, why do we feel that there's going to be an increase in coronavirus, COVID-19, come August or September? Some of the thoughts are that with the virus, it's going to be seasonal, as many viruses and flus have always been, but also that this particular virus is susceptible to heat. So as the months got warmer and the season got hotter, the thought was that it's going to decrease and there will be a flattening of the curve. But as the weather starts to change again, especially in the northern states, and it gets cold again, then the virus can potentially come back with a vengeance. So it's going to be very important to pay attention, to still shelter in place, to socially distance yourself, and to stay on the lookout for symptoms in yourself and get treated, and to listen out for the vaccine when it does become available.
My name is Martina James Bryant, and I am a curious senior citizen. My question concerns the use of a 3-word term, flatten the curve, which appears in conversations or pictures illustrated with graphics. My question is, what do the graphics represent?
Question was asked, what do the words flattening of the curve mean? We have all heard these words mentioned in multiple reports during these last 3 to 4 months. What flattening of the curve means is that you have a timeline, days, weeks, months, years, as to what is going on, whatever the case may be. In this case, we're talking about a virus, coronavirus. So now we're talking about numbers of cases. We hear that there's 1,000 positive cases and 200 deaths, depending upon what city you're in. So you take these two events and put them on a graph, and you want to decrease the number of cases that are coming up in your area over the course of time. So that takes you from having a line that's going straight up to forming the curve, if you will, that where it comes down to a flat line. That shows that there's not as many cases that are being found in or detected as to how many people are being treated. So that shows that there's a decline in the number of cases when that curve gets flattened. When the curve is rising, the cases are going up, there's more people, there's more problems. So you want the curve to be flat and ultimately have a downward deflection.
Can antibiotics be used to treat the COVID-19 virus?
The question is, can antibiotics be used to treat coronavirus? Antibiotics in general are not used to treat coronavirus because it is a virus, and antibiotics are used to treat bacteria. However, azithromycin has been given for patients who have COVID-19 because of its anti-inflammatory or decrease of inflammation properties. But in general, antibiotics are not used for COVID-19.
I would like to know where the virus is coming from. Is it coming from the air that we breathe in and out? So.
Next question is in regard to if COVID-19 is airborne or is the virus in the air. So the virus is carried on respiratory particles, which are found in our nose and in our mouth. So if someone sneezes, they release quite a few respiratory particles, which if they have COVID-19, they can be in the air. There are some studies that show COVID-19 can stay in the air for about 3 to 5 minutes. That's why it's important to wear your mask to stop transmission.
We hope that you have enjoyed our series on Ask a Black Doctor, COVID and our elderly patients. You know that our elderly are our most valued resource, but they're also the most vulnerable resource. And what we tried to do in this episode was to answer questions that they had about COVID. Please follow us on our YouTube page, ATL-Med, or our AtlantaMedicalAssociation.org website. And if you're so inclined, please make a donation. We are trying to do everything we can to help educate our community about COVID. Please join us in this effort. Thank you.